everybody. Today I'm going to be talking about physician-assisted suicide. So first I'm going to talk about what that is. First of all, I want everyone to imagine that you are laying in a hospital bed. And I'm going to show you. Okay. So you need to imagine being hooked up to machines, completely awake and unable to care for yourself. You're in pain all over your body, you're losing weight, you can't eat because you're nauseous or vomiting everything that you eat right back up. You know you're going to die, it's just a matter of when. So physician-assisted suicide is a delicate subject to some people. It should be the person's right to be able to choose if they wish to end their life or prevent them from suffering, any type of suffering. 3 states in the U.S. allow assisted suicide currently. And I think that every state in the U.S. should be allowed to do this as well. Everyone should have this option. Physician-assisted suicide is when a patient dies as a result from voluntary ingestion of a fatal dose of medication that a physician has prescribed for that purpose. So usually it's a sedative that they give a lethal dose, so it makes them just fall asleep peacefully. There's no pain whatsoever. People who are terminally ill can request the prescription for a self-administered lethal dose of a medication to end their life. There are certain qualifications for the request to be accepted, though. The patient must be diagnosed with a terminal illness that will lead to death within 6 months. A physician must confirm the diagnosis as well as a psychiatric evaluation. If there are any signs of a psychiatric disorder or the patient is bipolar or depressed in any way, the patient will be denied and will be sent for mental health evaluations. So no one can just end their life if they're depressed. They need to make sure they're at a steady mind and all that. There are many steps and options the physician must take before the patient can actually make their final decision to take the medication. The physician gives the patient alternatives like comfort care, hospice, and pain management. The patient may also resign the lethal dose at any time they want. The physician must also offer the opportunity to resign the medication when the patient asks for the second oral request. So they're going to ask for it 15 days earlier for the first request for the medication, and then 15 days later when they ask again for the medication, the doctor will ask them if they would rather do the other options that are available to them. So the doctor wants this to be the last thing that they want to do. After the medication is dispersed, whether it is to the physician, the patient, or the patient's agent, which is usually a family member, oral medication counseling must be offered to the patient or the patient's agent and be provided in person. Every person who is suffering or lives with unbearable pain every day should have the right to have an option for assisted suicide. People who want to live their life with dignity, this is why death with dignity was passed, which I will explain a little bit later. Having to live every day without an option but just to take medications or undergo medical treatment to somewhat and temporarily numb pain throughout your entire body is not a way to live your life, especially the rest of your life. So I will show you this picture. This is a picture of a man who had brain cancer. This picture was taken a year before this picture. And they explained in a documentary that I watched that by the end of his life, his eyes were literally bulging out because the brain cancer was swelling in his head, and he was just uncomfortable and in pain the end of his life. So on top of the stress of having a terminal illness yourself, your family members are suffering as well. Maybe not physically like you are, but financially and emotionally, it can be draining. And according to the DGS annual reports of Oregon, 89% of patients were concerned about losing their independence, 87% were afraid of being less able to engage in their activities, their daily activities, making life unenjoyable. 58% were afraid of their loss of dignity, 39% were afraid of the burden on the family or friends or their caregivers, because it's a burden for them too. And 27% were afraid of inadequate pain control, which is a big deal. I've had personal experience with seeing someone suffer the last part of their life. My grandpa had liver failure for over 10 years, and it eventually led to kidney failure along with cancer throughout his digestive system. My grandpa didn't want to die. He was a very active man, and he played in Senior Baseball World Series and won. He was a senior when he did this, so he's really old. He was active in church every week, and he was teaching his grandkids how to play baseball or softball, one of which had an offer his senior year of high school to play for the Dodgers. He was playing all the way up until he couldn't handle the pain anymore. To see the face my grandpa would make because of the amount of fluid crushing all of his organs when he was just sitting down or laying down talking to you was one of the hardest things to see. In just a matter of 3 months, he went from sliding into home plate to someone who can't even lie down without having labored breathing just to push through the pain that he was in. And it wasn't a long amount of time between when all of his organs started to fail until he was in this amount of pain, and all the fluids in his body were kind of just leaking into his stomach. It wasn't pretty, and he didn't enjoy it. He just didn't look like the same person. His life consisted of pumping 2 liters of fluid out of his belly, dialysis 3 days a week, 4 hours a day, to pain management just to fall asleep every night. He knew he had a few months to live, but why should he not have the option to end his life? Just the option to end his life if he wanted to, so he could and we could remember the time of when he was living his dream, not suffering every day. There are 3 states in the U.S. that have assisted suicide legal. Oregon was the first state to allow physicians to help people who are terminally ill their life with dignity. This is what they call the Death with Dignity Act. Washington also passed the Washington Death with Dignity Act. Both states have multiple requirements for a patient to be approved for assisted suicide. This prevents the abuse of having this option available. Montana is the 3rd state to approve the law. The state ruled that terminally ill patients have the right to die. On the other hand, they do not have additional requirements as to who qualifies for assisted suicide, which can lead to the abuse of it. All in all, a physician prescribes a medication to help a terminally ill patient who suffers every day to die with their dignity and any good memories of their life. This is a right that every person should have everywhere in the U.S., not just the 3 states. After seeing or living through the pain that these people go through every day, you would agree with having the right of the option of death with dignity and prevent any further suffering that is to come. Not everyone will use this option, but to have it available to those who wish, it is worth passing the law in every state. So I hope you guys enjoyed my speech.